Orthopedic doctors agree on one important truth after the age of 60. Walking is good for your heart, but it does very little to stop muscle loss. This condition is called sarcopenia, the age-related loss of muscle mass. After age 30, we lose about 3 to 5% of our muscle every decade. By the time we reach 70, that loss can climb to as much as 30% of total strength. A groundbreaking 2023 study from the University of Missouri found something remarkable. Adults over 60 who performed chair-based exercises improved their functional strength 27% more than those who only walked. Another study from Harvard Medical School 2022 followed more than 2,000 older adults for 18 months. The results were striking. The group that performed seated resistance exercises gained muscle, while the group that only walked lost muscle despite being the same age and having similar health. Most astonishing of all, exercise number 1 on this list increased bone density by 19% in adults over 65 and is now being prescribed by doctors for patients recovering from hip replacement surgery, outperforming many traditional physical therapy protocols. Before we begin, leave us a comment and tell us, how old are you and where are you watching from? We read and reply to every single comment. Exercise 5. Seated calf raises. This movement targets one of the most overlooked muscle groups in the lower body. The calf muscles, especially the gastrocnemius and soleus. Every time your calf muscles contract, they squeeze the veins in your lower legs and push blood back toward the heart. When the calves are weak, blood can pool in the lower body, leading to swollen feet and ankles, varicose veins, and most dangerously, an increased risk of blood clots. A 2021 study published in the Journal of Applied Physiology examined 140 older adults with mild circulation issues. The results were clear. After performing seated calf raises 3 times per week for 12 weeks, participants experienced 41% improvement in venous blood return, noticeably less ankle swelling and lighter legs, a significant reduction in the risk of deep vein thrombosis. The group that did not exercise showed no improvement at all. How to perform it correctly. Sit on a sturdy chair with your feet flat on the floor, knees bent at about 90 degrees. Press through the balls of your feet and lift your heels as high as possible. Hold for 2 seconds at the top, then slowly lower your heels back down. That slow lowering phase is critical. It creates eccentric muscle contraction, one of the most powerful drivers of muscle growth. If you're just starting, begin with 15 repetitions. Progress to 3 sets of 25 reps. Once it feels easy, you can place a weight on your thighs appropriate to your strength level to increase resistance. Doctors strongly recommend this exercise because people with knee or hip joint problems can still perform it safely. It places no harmful stress on the joints, yet delivers powerful benefits. Exercise number 4. Seated knee extensions. This exercise directly targets the muscle group that determines independence. Your ability to climb stairs, step out of a car, or stand up from a chair or toilet without assistance. That muscle is the quadriceps, the large muscle group at the front of the thigh, the primary driver of most daily movements. A 2020 study from the University of Vermont followed 400 adults over age 60 for 5 years and found those who did not perform targeted exercise lost an average of 16% of their muscle mass. In contrast, those who performed seated knee extensions 3 times per week gained 4% thigh muscle. That's a 20% difference in outcomes created by one simple exercise. When you extend your knee while seated, Your quadriceps must lift the entire lower leg against gravity, sending a strong resistance signal to the muscle. How to perform it? Sit upright on a chair, holding the sides of the seat for balance. Extend one leg straight out, toes pointing up. Hold for 3 seconds while tightly contracting the thigh, then lower the leg slowly over 4 seconds. Perform 12 repetitions per leg for 3 sets. Orthopedic doctors recommend this exercise for adults over 60 because strong quadriceps protect the knee joint, acting like shock absorbers with every step. Before we continue, if you're finding this video helpful, please tap the like button so more older adults can see it, and subscribe to the channel. We share new senior health tips every day, and you won't want to miss the next video. Exercise 3. Seated hip marches. The hip flexors are the silent controllers of your ability to walk. These muscles, primarily the iliopsoas and rectus femoris, are responsible for lifting your thigh every time you take a step. When hip flexors weaken, your walking pattern changes. You stop stepping and start shuffling. That's one of the main reasons older adults trip and fall. A major 2022 Mayo Clinic study involving 800 adults aged 60 to 85 found weak hip flexors increase fall risk by 4 times. According to the CDC, 1 in 4 adults over 65 falls each year. 20% of those falls result in serious injury. And most alarming, 30% of people who suffer a hip fracture die within 1 year. Seated hip marches directly strengthen the muscles that prevent falls. How to perform it? Sit near the front edge of a chair. Keep your back straight and lightly brace your core. Lift one knee toward your chest. Hold for 2 seconds. Lower it slowly, then switch sides. Perform 20 alternating repetitions for 3 sets. To increase the difficulty, you can hold your leg at the top position for 5 seconds instead of 2, or wear ankle weights once the basic movement feels easy. This movement mimics walking, but it's stronger, more controlled, and safer. Exercise 2. Seated resistance. Band rows. Almost every daily activity requires pulling strength, opening doors, getting out of bed, pulling on clothes, carrying groceries. All of these depend on your back muscles, especially the latissimus dorsi rhomboids and rear shoulders. These muscles are what keep your spine upright and prevent a hunched posture. When back muscles weaken, gravity begins to win. The upper spine rounds forward, a condition known as kyphosis. This doesn't just affect appearance. It can compress the lungs, making breathing more difficult. Shift your center of gravity forward, increasing fall risk. Cause chronic neck and shoulder pain. A 2021 study following 300 older adults over 6 months found the seated resistance band row group improved spinal posture by an average of 8 degrees. The walking-only group showed no change, even more impressive. The rowing group reported a 63% reduction in neck and upper back pain. How to perform it? Sit upright on a chair with feet flat on the floor. Hold the resistance band with both hands. Pull your elbows back. Squeeze your shoulder blades together. Hold for 2 seconds. Then slowly release. Perform 15 repetitions per set for 3 sets. The last 3 reps of each set should feel challenging. Strong back muscles are like the anchor ropes of a tent. They keep the spine aligned, stable, and protected from degeneration. Exercise 1. Sit to stand squats. Sit to stand is not just an exercise. It's considered a predictor of longevity. A large study published in the European Journal of Preventive Cardiology followed more than 2,000 adults over age 60 for 6 years and found those who could not stand up from a chair without using their hands had a 5 to 6 times higher risk of death. The sit-to-stand movement activates nearly the entire body. Quadriceps extend the knees. Glutes extend the hips. Calves maintain balance. Core muscles stabilize the torso. Back muscles keep the spine upright. A 2023 study found that adults over 65 who practiced sit-to-stand 3 times per week increased bone density by up to 19% in the hips and thighs, a result that is extremely rare at older ages. Orthopedic doctors now view sit-to-stand as a form of preventive medicine. All you need is a sturdy chair and 15 minutes 3 times per week to protect your independence and quality of life. Walking is excellent for cardiovascular health, but if your goal is to maintain independence, prevent falls, preserve bone density, and keep your muscle strength, then these 5 seated resistance exercises are exactly what orthopedic doctors recommend for everyone over 60. Please share your thoughts and experiences in the comments below. We truly enjoy hearing from you. Thank you for watching.